Assalamu alaikum. I am Dr. Nishat, Assistant Professor of Physiology, and today I will be talking about the stalling forces. What is stalling equilibrium? Stalling equilibrium is nothing but under normal condition, it's a state of near equilibrium which exists in all capillaries. That is the amount of fluid which is filtering outward from the arterial end of the capillaries equals almost equally the fluid returning back into the circulation by the process of absorption. There will be a slight disequilibrium that occurs which accounts for the small amount of fluid that is eventually returned to the circulation by the lymphatics. This is a chart showing the principles of stalling equilibrium. The mean forces tending to move fluid outward, which is about mean capillary pressure, which is about 17.3 millimeters of mercury, and the negative interstitial free fluid pressure, which is about 3 millimeters of mercury, interstitial fluid colloidal osmotic pressure, which is about 8 millimeters of mercury. Therefore, the total outward force is about 28.3 millimeters of mercury. The mean forces tending to move fluid inward is exerted by the plasma colloidal osmotic pressure, which is about 28 millimeters of mercury. So, the total inward force is exerted is about 28 millimeters of mercury. Summating of the mean forces, the total outward force is 28.3 millimeters of mercury and inward force is 28 millimeters of mercury. So, the net outward force is about 0.3 millimeters of mercury. There is a slight disequilibrium or imbalance of forces of about 0.3 millimeters of mercury, which causes more fluid undergo filtration across the arterial end into the interstitial space, then reabsorption. This slight excess of filtration is called the net filtration, and this fluid must be returned back into the circulation via the lymphatics. The normal rate of net filtration in the entire body is about 2 milliliters per minute. Mechanism of blood flow. The local blood flow, the control of the local blood flow can be divided into two phases, the acute control and the long-term control. Acute control is nothing but it's a rapid changes which occurs in the local vasodilatation or vasoconstriction of the arterioles, meta-arterioles and precapillary sphincter. It usually takes about seconds to minutes. And the long-term control mainly refers to the slow changes in the flow which occurs over a period of days, weeks or even months. The blood flow is mainly controlled according to the need of the tissues. An increase or decrease in the physical sizes and number of actual blood vessels supplying the tissues. Factors affecting the caliber of the vessels. The certain vasoconstrictor agents like local factors, which includes decrease in the local temperature and autoregulation. Some endothelial products like endothelial 1, angiotensin 2, thromboxane A2. And circulating hormones includes epinephrine, except in the skeletal muscle and liver, norepinephrine, vasopressin and angiotensin 2. And some neural factors includes increased discharge of noradrenergic vasomotor nerves. Some vasodilator agents includes increase in the carbon dioxide concentration and decrease in the oxygen concentration, increased potassium ion, adenosine, lactate and increase in the local temperature. And some endothelial products includes nitric acid, kinins and prostacyclin. Circulating hormones includes epinephrine in the skeletal muscle and liver, substance P, histamine, atrial natriuretic peptide. And neural factors includes decreased discharge of noradrenergic vasomotor nerves, vasodilator parasympathetic to the penis. Effect of tissue metabolism on the local blood flow. The two basic theories for the regulation of acute blood flow. One is the vasodilator theory. The other one is the oxygen lag theory. Let's have a look at the oxygen lag theory. It says a decrease in the oxygen availability to the tissues such as at high altitude at high altitude at the top of a high mountain. Number 2 in pneumonia. In number 3 in carbon monoxide poisoning. And number 4 in cyanide poisoning, the blood flow through the tissues increase remarkably. Vasodilator theory. The greater the rate of metabolism, the lesser will be the availability of oxygen and the greater will be the formation of vasodilator substances like carbon dioxide, hydrogen ion, potassium ion, etc. in the tissues. These vasodilator substances will diffuse through the tissues to the precapillary sphincter, meta-arterioles and arterioles and finally cause vasodilatation. Autoregulation of blood flow. It is the mechanism that allows many organs and tissues to adjust their vascular resistance and maintain a relatively constant blood flow in presence of changes in the arterial blood pressure. Autoregulation of blood flow occurs in kidneys, brain, heart, skeletal muscle and mesentery. Thank you for today.